Good afternoon, everyone. Good afternoon. I'm happy today we could come online and we could see ourselves and talk. So happy Sunday, happy first Sunday of the month, and I welcome us all to the month of June, a month of blessing and extraordinary glory. So I just hope we can all keep to how holy this month is going to be, because don't forget, this is the middle of the year and it's very, very important. Whatever you do this month is going to determine what will happen in the coming months. So while we do that, I would briefly not take much of our time. What we'll be having today is just a little talk, a little health education, health tips for our pregnant mothers and our nursing mothers. So I would like to introduce myself. I am Nurse Anane, a registered nurse, and also I have passion and flair for pediatric nursing, that is for babies, for newborns. And I bring to you Becca Health Foundation Health Talks, brought to you proudly by yours truly, your favorite nurse. So what do we do at Becca Health Foundation? We keep you informed about how to take care of your newborns and our pregnant mothers, our nursing mothers, and children from the ages of 1 to 5 years. That's what we basically do. And sometimes we go on outreaches, visiting our primary health centers, reaching out to our nursing mothers, reaching out to our pregnant mothers, encouraging them on how to take care of themselves, how to take care of their newborns, how to take care of their young ones. But for the past few months, we've not been going on outreaches because of the situation of the COVID and all that, and the fear of visitors coming into their premises. So for now, we are just based on our live videos. But some of the times, our pregnant mothers don't meet up with our live videos. So what we do is post our videos on our YouTube channels. And every other time, I do post the link on the Facebook so that you can get the link, go to our YouTube channel, you can subscribe on our YouTube channel, try to criticize. We need your comments, we need your critics, we need whatever you need to say, because they help us and they make us better. So when you do that, they make us improve in any area you want us to improve on. So today I just have, thank you for joining in, Mr. Oluwaseun Divine Sami Ezekiel. I appreciate your presence here. And what we are having today is just a little health tips for our nursing mothers. Like I said earlier, what we basically talk to the set of people, that our target audience is nursing mothers, the pregnant mothers, and our mothers that are taking care of the young ones from ages 1 to 5 years. But sometimes we do talk to our general public, because when you go to our YouTube channel, you might see various topics that we've discussed, where we talked about depression, we talked about HIV/AIDS, we talk about a lot of things. So if you need any insights on these topics, you can go to our YouTube channel, watch and learn. So today we'll be talking about care of the breast during nursing, care of the breast of the nursing mother. Who is a nursing mother? Let me start with that. So a nursing mother is someone who has just delivered a baby, a newborn baby, and is still breastfeeding, because a newborn, the only food for them is breast milk. So we want to advise our mothers on how do they take care of their breast that they feed our newborns with. How do you care for it? How do you really protect it? Because these newborns, their immunity level at that stage is still not high as it should be, but they still have a quantity of immunity in them. Why? Because of the first breast milk they took, which is the colostrum. Now, that colostrum helps to build their immunity when they are born and when they are breastfed immediately after being born, unless stated otherwise by you. So sorry about that. Our network has started failing us again today. I just pray we are able to talk to what we have for us today. So like I was explaining earlier, How do you care for your breast? Because these newborns, they can't talk, they can't tell you, oh mommy, your breast is dirty, I can't suck it. So as a mother, you have the responsibility being laid on you on how you care for your breast. It determines how the baby looks healthy. There are some baby that comes down with different kind of diseases, such as oral thrush, candidiasis, because of unkept and unclean breasts. Let me put it that way. So how do you, as a mother, how do you take care of this breast? How do you clean them up before breastfeeding and after breastfeeding? How are you supposed to dress? There are some mothers that will tell you, I don't feel like wearing bra when I'm breastfeeding. No. Why would you do that? There are nursing bras that are actually required as a nursing mother that you can put on to aid easy breastfeeding and even make you comfortable. At the end of the day, you would be happy with yourself and also be happy with the fact that you're breastfeeding. So that's what we'll be talking about today. So the first point concerning the care of the breast during nursing is cleaning. How do you clean your breast? Now, you can clean your breast every morning in a shower bath, or you can decide to clean them with warm water before breastfeeding. Just put a towel, you damp it in warm water, use it to clean the areola and the nipples. Now, when I talk about the areola and the nipples, as a mother, the you see the black part, the black area that the baby actually latches on when it's sucking. So that is your areola. Then you see a pointed part, that is your nipple. If you really need explanation on the breast, I've done a lot of teaching on breast. I took 3 weeks or so to explain it. So please go to our YouTube channel. You'll be able to get more information about the breast. So you clean it with warm water before you breastfeed your baby daily. Make sure it's daily. And then another thing you need to take note of is the kind of bra you use. Make sure you use a cotton bra, a nursing cotton bra. Now, this kind of bras help to allow hazy hair passage into the body and thereby preventing dampness around the areola area. Why? This is prevention. This is a means of preventing mastitis, is an inflammation of the breast, and also preventing other diseases that might come to you as a mother due to the wetness of the area. Because definitely when you're breastfeeding your baby, there will be a time the baby might stop sucking, and then you will notice your breast milk drips. And when it drips and you don't clean it up, you leave it there, it helps germs and bacteria to grow on your breast and thereby exposing your baby to a lot of other diseases. Thank you. Yes, gastroenteritis too is there, thereby exposing your baby to other infections that are not actually good for the baby. I get your, is the areola the ring gum on my breast? Okay, so I guess people are asking questions how the areola looks like. Yes, it has a ring form that is on the breast. It has a ring form, but it's darker in complexion. It's a dark area than the breast itself. So the darkest part of the breast, let me put it that way, the darkest part of the breast is actually the areola. So like I was saying, you have to make sure your breasts are not damp. They are always dried. And when you notice you have cracked nipples, that is, your nipples are sore, and you feel, oh, when my baby sucks it, I feel pain, you can actually talk to your health practitioner, you can talk to your nurse, or you can talk to your doctor about it, and they will be able to tell you, okay, you can use there are some gels that are actually hygienic for a nursing mothers to use, or they will advise you to use pad. There are pads that mothers use when nursing. They allow you to use pads that contains this gel, so that when you put the pads on your breast to prevent the breast from leaking, it helps to actually lubricate the areola and the nipple and prevent it from being dry and cracked. So please and please, as mothers, let's try to treat these cracked nipples on time. Don't just endure the pain, because sometimes some cracked nipples develop into mastitis and other conditions such as cancer of the breast. So don't just keep quiet about it. Try to talk to someone about it. And please don't start using any gel because a over the counter person told you this is advisable. Please talk to your health practitioner before you do. Sorry, another point to note is, as a nursing mother, you will definitely have leaks from your breast, because it's normal. It's actually normal, because it's not all the time that you breastfeed your baby and the baby will be able to empty that particular breast. There are sometimes the baby might not be the foodie type and will just suck a little, and then you notice your breast is still full. So you can use breast pad before you put on your bra. This helps to soak the breast from leaking into your bra, because when your bra is damp and wet, it helps to grow bacteria also, and this also affects the health of the baby. So those are the points I would want us to talk about. And another thing is, please and please, it's normal for you to notice any lump in your breast when your breasts are full after delivery. It is normal. It's a sign that you're actually producing enough breast milk for the child to take. Now, it is just not normal that after the baby has sucked the breast or has taken in the contents of the breast, you are still noticing the lump for like 3-4 days. Please get my point. It is normal that a breast should have signs of lumps, like little lumps. You can feel it in your breast when you touch, when you palpate, little lumps before breastfeeding. It's a sign that your breast is full already. But after the baby has been breastfed or sucked and you feel okay, this breast is kind of empty, and then you notice that the lumps don't go away for after 2 to 3 days, even as the baby is still sucking continuously. Please and please, you need to see a doctor to check out what the lump is all about. Don't just say, okay, it's normal for the lump to be there because my breast is full, then you just know. Because sometimes the lumps might be a sign of something else, and when you don't take notice of it, it exposes you to a lot of dangers as a mother, and we are not ready to endanger our mother. Like I said, our health foundation is all about prevention. We try to prevent you from coming down with a particular disease. So that's why we come up with these health tips and health topic. Another question is, what do I do when my breast bleeds on suckling? Should I continue breastfeeding with the blood or I stop? I wouldn't advise you to continue breastfeeding. Why? Because bleeding is actually a sign of an infection, or it could be something else. So when you notice your breast is bleeding, instead of bringing out breast milk, we all know the color of breast milk. That's why I used to advise my pregnant mothers, know the taste of your breast milk. There was a mother I was advising the other day. Okay, she actually expressed and then she kept it. So after some time, the baby woke up. I fed the baby, and then when she came back, she was like, the baby has not exhausted the milk and I should pour it away. So I told her, come and have a taste. So you would know when your breast milk is sour when you are at home, and you will know when it is still fresh and good for feeding. So she was like, she can't take breast milk. She can't take breast. No, I had to just sit her down and explain to her, and she had to test it. So she knew the difference. So it's always good as a mother. You should know the color of your breast milk. You should know its taste, because you'll be able to differentiate when the breast milk is sour or when it's still edible for the baby to take. For those that are expressing, that's for expressing mothers. But for a breastfeeding mothers, you should also know the color and how it looks like. Now, when you notice your breast is bleeding while the baby started sucking, I would advise you stop breastfeeding at that point in time. And why is that? You might be able to notice or see cracks on your nipples. And when you notice cracks on your nipples, you can be able to attend to it on time. That is why I said earlier when I was explaining about the cracked nipples, please and please make sure you are cleaning your breast with warm water. This makes it moistened and also prevent it from being cracked and dry. And also, when you notice you have cracked nipples, you can talk to your practitioner about it, and he or she might be able to prescribe a gel that you can use on your pads, the pads that you use to prevent your breast from leaking out. You use them on your pads, or there are pads that contains those gels already. You use the pads, and then they help to moisten your nipples. So those are the points. Thank you for the questions, and thank you for all those that joined. So those are the points we'll be talking about today. Firstly, I talked about cleaning your breast daily. Maybe when you're having your bath or your shower, or if you've not had your shower before you wanted to breastfeed, please clean with warm water. You can put a clean towel in the warm water, use it to damp it, and use it to clean the breast. And you also prevent the moisture around the breast, prevent your breast from being wet. Let me just put it that way. In case if your nipples leaked and then you notice breast milk all over your breast, you can actually clean them up before dressing or before putting on your breast pads or anything. This prevents the growth of germs and bacteria, and actually prevents them from growing and infecting your baby, because the baby's health is the most important. Though you are also important as a mother, don't get me wrong, but my babies are more important. Try to get what I'm saying, because you exposing them to these bacteria and these germs makes them exposed to a lot of infections like gastroenteritis and the sorts. So please and please let us take care of our breasts. And for those that are expressing, try and use your breast pads. Wash them daily. Don't use breast pads when they are wet and sticky, because those breast pads too can harbor germs. Please and please don't use your breast pad. Mr. Prince, you're not in the wrong place. You can actually learn and actually teach your wife later on. You can teach your wife later on. So this is a teaching. This is something you can learn for future use. And if you're married already, you can actually tell her about it, that, oh, come and see what I learned today. So you're not in the wrong place. Please stay. So you make sure you wash your breast pads daily. Don't use them for 2 days, 3 days. I know of some, they will use the breast pad, they will say it's wet, they will go and dry it in the sun, and after the sun has eaten it for a while, you use them. No, it's very wrong. It's very wrong. Though they might not be moist, but that breast milk can actually harbor germs. So you use the breast pads and wash immediately. So those are the very, very important points you need to know. And when you notice cracked nipples and dry nipples and they are sore when breastfeeding, please and please report to your health practitioner, where they can give you a gel where you can use on your breast pad or while breastfeeding. And don't forget, we have nursing bras. Yes, we have nursing bras. If you want to buy any, you can hit me up on my Facebook page. I have a sure connection. I have a sure link for you to get your good quality nursing bras that are easy for breastfeeding. So you can just send me a DM after the live video if you need nursing bras, and I'm gonna put you through. Okay, another question just came in. 1 week after birth, milk does not flow. What do I do? Okay, like I do tell my primate, when I say primate, my first time mothers, what I do is I encourage them. I don't discourage them. I encourage them. Continue taking your food, continue taking your liquid diet. When I mean liquid diet, your ogi, your pap, your tea, your milk, continue. And then still try to express, and also try to put the baby to breast, except contraindicated. When I mean contraindicated, there are some situations whereby maybe the baby came down with sepsis after delivery, because there are some babies that after delivery you notice that they came down with sepsis, they came down with infection, and they're on treatment, and they will tell you nil pahora, that is no food for a while. The baby will only be on antibiotics, so you're not supposed to breastfeed. And even if the baby is eating or has commenced feeding, they will tell you you will not allow the baby to suck directly. You have to express and then feed, maybe via NG tube, or you just put it in the baby's mouth via cup and spoon. But as long as it's not contraindicated, I will still advise my mothers, please continue to put the baby to breast. As the baby continues to suck, the sucking reflex is send impulses to the brain, and then this helps the breast to produce milk. So I don't discourage my mothers. I don't say, okay, because you've not had breast, just continue, try other. But that does not mean you starve your baby. You can introduce baby milk, baby food such as Nan One. You can introduce that for the baby at that point in time. But even at that, I encourage my mothers, put to breast. Don't relent, and try to express. Sometimes I assist them in expressing. I encourage them and I assist them in expressing. And you notice maybe it's not as if there's no milk coming out. It just doesn't come out in the large quantity you want, but something is coming out, which means it is being produced. It just needs the stimulus, the reflex to be sent to the brain to produce more. So what I do is I'll tell them, put to breast. Continue to put to breast, and don't stop your diet, your liquid diet, your fluid diet. Don't stop it, because those are the things that help to increase the fluid in the body. So I guess I've answered that question, and thanks to the person that asked, I really appreciate that. So that is just all for today. I wouldn't want to take much of our time because, like I said, I just have a little topic on care of the breast during nursing. So I hope we've all been able to get 1 or 2 points about how to take care of your breast and how to care for them while you're breastfeeding, so that we don't harm my young ones, my precious young ones. We don't harm them, and then we'll help to prevent them from coming down with different infections, different diseases. Because sometimes when I see these young ones admitted, and I'll be like, oh, I can't bear to see them in the hospital, and then they take injections upon injections, they take drugs upon drugs, and they are placed on nil per oral. They can't eat, and they cry all night. God, their cries harm me a lot. Like, I feel as if I feel their pain. So please and please, to prevent such occurrences and to prevent such events, please let us try to clean our breast well. Take care of your breast well. Prevent the growth of infections. Make sure when you're cleaning your breast, make sure you raise them up. You lift them up with one hand and use the other hand with a dry towel to clean underneath the breast. Also clean underneath the breast. It's better that you clean underneath the breast, because sometimes germs also grow underneath the breast, because when the breast falls down, it produces warmth and moist underneath, and then germs can actually grow there. So please clean underneath the breast, around the breast. Make sure they are dry and there is no moist for germs or bacteria to grow anywhere. And please, one important point before we leave. Please, when you want to disengage your baby from sucking, or maybe the baby have slept off and the nipples are still attached to the mouth, don't just use force to withdraw the breast from the baby's mouth, to withdraw the nipples from the baby's mouth. It can actually make you get cracked nipples. I've noticed such, and the mother had to cry out, and she was like, because she felt pain. And I was like, you used force. Because sometimes these babies, what they do is they use their gums to hold on to latch well to the nipple, so that they can enjoy themselves to the fullest. And when you are not patient enough to disengage the breast for their mouth, you get pain in return. So what I do is just try to put one of your finger on the cheeks of the baby. Try to open the mouth up, and when you notice that the gums are not attached to the breast, then you withdraw gently. Use one of your finger, maybe the hand that is holding on to the head of the baby, use it to open the mouth. Check if the gums are not latched, then you withdraw gently. Another question, this is going to be my last question before I go. Can I allow my husband to suck my breast within the 6 months? Within the 6 months, I guess that should be after delivery. Within the 6 months, okay. It's not advisable, right? Actually, it's not advisable. And why is that? Because solely at that point in time, the immunity of the child is not strong enough to bargain with different kinds of bacteria. Now, the breast is solely for the child at that point, because you are to practice exclusive breastfeeding. When I mean exclusive, the baby is not taking any other thing aside from breast milk. Now, in a case whereby you are allowing your husband to suck, your husband might go out and meet with different kind of people, and there are different germs that are growing in the mouth of an adult. I can't even fathom it. Different germs are growing in the mouth of an adult, and when this person or your husband tries to suck on the breast, the person transmits the germs in his mouth on the nipples, on the areola. And I know some mothers are so lazy. When they notice their babies are crying, they just carry, oh yeah, come and suck. You don't even remember to actually clean first with warm water, to actually clean the area, make sure it's clean. Even if the baby is crying fire and brimstone, you have to clean first before you allow the baby to suck. But some mothers are so lazy, they might not remember. And you not remembering, just putting your baby to suck that same germs that your husband has transmitted to your breast. Oh yeah. You are exposing that baby's gut to a lot of bacteria, and their guts are not that strong. When I mean guts, their intestines are not that strong enough to manage this kind of different bacteria they are exposing them to, and this makes them weak. They have weak immunity, and then you expose them to gastroenteritis and the likes. So it's just advisable. I don't advise it. No. For that 6 months that your baby is going to be fed, it should be exclusive, and it should only be for your baby. And when you decide to introduce complementary foods later on, you can decide to start your lovebirds with your husband. But please, for my baby's sake, I love those my babies. Like I said, they are precious to me. Please and please, the breast should be for only my neonates. So I think I've answered that question, and that will be my last question for today. So thank you all for those that joined. I really appreciate you. The questions asked, everything, they were educative enough, and I also thank you all for your interactions. And please, if you're not able to join on time and you couldn't get more of the info, don't worry. The live video will be posted after this episode, and you can also go to our YouTube channel and to learn more, because I've been mentioning gastroenteritis. I've actually treated this as a topic, and it's on our YouTube channel, so you can just go there, read more, and know what gastroenteritis is all about and how it affects our young ones and how it endangers their health, so you can learn more. So thank you all for joining in. I remain your humble host and favorite nurse Anane. Have a wonderful evening. Have a good day. Thank you. Bye.